Mrs. Griffin, it's a good thing you brought this child in.
Why? Is he okay?
I'm afraid he's very sick. In fact, his lab work shows he's suffering from Hodgkin's lymphoma.
Oh, no.
Scotty has cancer?
I don't know. I didn't read the whole Wikipedia entry in the 80s.
Okay, hold on. Okay, we'll talk about Hodgkin's lymphoma in a moment. But when the doctor says he looked it up on Wikipedia, I think you want to turn and run the other direction. Wikipedia is not a medical source. Yes, we look things up on medical sites, not Wikipedia that anybody can add information to. That's horrible. Doctors never do this. Oh my gosh, he backed away and has a tip jar there. This is absurd and non-professional.
Do you have any idea how expensive medical school is?
No, I don't.
Well, it's probably pretty expensive.
Oh my gosh. Okay, let's break this down for a second. Hodgkin's lymphoma and non-Hodgkin's lymphoma has to do with a type of cancer relating to your lymph nodes. The white blood cells of your body are being made inappropriately, and in this type of cancer, you have different therapies that you do, radiation and chemotherapy. Most of them are treatable, and people do really well. But then this doctor goes into describing his medical school debt. Yes, after 12 years of education and schooling, doctors have a lot of student debt, but never in my career have I ever heard or seen of a doctor pulling out a tip jar. That's horrible.
Dr. Hartman, please tell me, is my husband gonna be all right?
Cancun, actually. Thanks for asking. Just got back. Mr. Griffin, I'm afraid all the toxic chemicals your husband ingested from his homemade energy drink have caused total kidney failure.
Oh my God! Kidney failure?
Some different types of things that you can ingest can cause kidney failure, such as antifreeze is one of them. People will drink that because there's an alcohol component to it, but it can actually clog up your kidneys and cause renal failure. Just don't ingest anything that you shouldn't. Kidney failure, different things can actually erode your esophagus and your stomach and your lining, cause gastrointestinal bleeding.
But is he gonna be okay?
Well, yes and no. We'll put him on a kidney transplant list,
Whoa.
but that could take months. Until a donor is found, he's going to have to undergo dialysis treatments 3 times a week.
Dialysis?
Yep.
Is there any other way?
Whoa.
Yes, there is.
No. We'll do the dialysis.
We need our kidneys to function to get all the toxins out of our body. We then will say, okay, you need hemodialysis, which is what everybody refers to as dialysis, where you get a big IV line in, and literally, it's taking your blood out of your body into a machine, cleaning it up, so to speak, and then putting it back in. People have to sit maybe 4 hours a day, 3 times a week to have this done so they can function. 3 weeks later.
Hey, Doc, I'm here for my dialysis.
Have a seat, Peter. Let's get you hooked up.
Doc, I don't know how much more of this I can take. It's been 3 weeks.
I know. I saw the caption.
I just go crazy just sitting here for so long.
Oh, I know it's tough, but maybe there's something I can do to make it easier. Here, play with this bucket of afterbirth.
Oh my gosh. So afterbirth is another word for the placenta. That's disgusting. And he's picking up with his bare hands. Oh, what? That's horrible. But yes, dialysis can be very boring, but it's necessity because if the electrolytes go haywire, it actually could kill somebody.
Oh my God! That shark's attacking Quagmire!
I think it's got him by the wiener!
Oh, that's horrible! Oh my gosh, that's horrible. All right, shark attacks are a thing. It's all bandaged up, okay.
Doc, give it to us straight.
What'd they do?
What's going on with our friend?
Well, Mr. Griffin, there's no easy way to put this, so I'm just going to come right out and say it. He's black.
Not that friend, Quack.
What? Oh my God. Oh, that's horrible.
Okay, but you're going to have to learn to live without a penis. Or will you?
Oh, that's so messed up. That is so messed up.
That is kind of rad.
Your gift is inside.
Oh my gosh, what is this?
Is that your...
Yes, Glenn. It's my penis.
Oh my gosh.
After my surgery, I kept it in my freezer. I want you to have it.
The likelihood that this organ is viable is probably 0 to 0, but it's a nice gesture. People actually do this all the time with kidneys. Never really heard for a penis.
I'm so nervous for Quagmire.
I know, but it's nice that they served hot dogs for the surgery.
There it is. Give me that.
Oh my gosh, he stole the doctor's food. Here we go. So a urologist would specifically be doing
Nurse,
this.
you put it on there. I'm not gay.
Oh my gosh, that's horrible. Anatomy is anatomy. Physicians don't ever say that. We look at everything from an anatomical viewpoint.
The operation was a success.
Congratulations,
Nice.
Quagmire.
Thanks, guys.
All right, He had a successful replantation of his penis, so hopefully it works. Usually after surgery like that, you'll probably have a Foley catheter in place. That way you can drain fluid out, aka urine, and that way there's no issues having to urinate.
Okay, heart sounds good. All right, Mr. Griffin, I'm just going to need you to drop your pants and we'll check your prostate.
What?
Drop your pants, turn around, and lean forward.
Okay.
Again, he's not wearing a hospital gown, so we need to do that. Dropping your pants to do a prostate exam, it's just so blunt. I think the easiest way, the nicest way for a patient, unfortunately, is to maybe lie them on their side, cover them with like a sheet or a blanket, and only expose the buttocks and do the procedure. The whole procedure's not comfortable.
So how's this work? You just feel my pulse? So
Oh my gosh. Whoa. The prostate sits right next to the rectum, just below the bladder. We're looking to do a screening test to see if there's any lumps, abnormal growths, those sorts of things of the prostate, so we can detect prostate cancer early. So you do a digital rectal exam. Use a gloved hand, and you actually talk the patient through it, because if the patient is fighting against you, it's a muscle, so you can't get in. There's no sneak attacks when it comes to a prostate exam.
Mr. Griffin, that's a prostate exam.
Shut up! You had your finger in my ass!
That's how a prostate exam is performed.
Oh my gosh.
Now, if you'll just let me...
Get away from me!
Oh my gosh. It's not funny, but it's funny.
What happened?
I was raped.
What?
Even his wife's laughing at him.
He took my innocence.
What? Peter, that's a prostate exam.
Yeah.
It's an important part of a physical for men your age.
You sound just like him.
It is true. If you don't know what you're getting into, if you don't know the reason why or what the procedure is, you might actually feel like you are being violated. But a doctor's job is to explain what we're doing and why we're doing it. A patient can always refuse a procedure or a test, anything that we do, understanding the reason why we're doing it, the risks and the benefits of doing the procedure.
So, what can I do for you, Mr. Swanson?
Doc, I can't take it anymore. I want to walk again. I'll do whatever it takes.
Well, there is a highly experimental new procedure. It's essentially a leg transplant.
What? That's cool.
Sign a waiver. I think I may be able to help you.
He's paralyzed, right? His legs don't work. A leg transplant won't specifically work. So if he had a spinal cord injury, putting on a new set of legs, if the information to the legs is still in error, it's not going to work. Hopefully, we're going to move into the future where we could potentially have these new neuroconnectivity to previously paralyzed parts of our body that can then work. That'd be really cool and awesome.
We'll select the legs most suited to your body from our inventory of donors.
I love it. I love it. Okay, there you go. Nice. I love the different options. At least you can see what the future holds.
Ah, good choice. These are the only ones we have in stock that aren't hilarious.
I'll take them. All right, Doc, I trust you.
Good. Now I'll just pop in the how-to video and we'll get started.
Oh my gosh.
What?
Oh
Hi,
no.
I'm Jamie Farr.
You never want to hear that before you're going down. So typically when you're going for surgery, you will be given medications in the IV. But you never want to hear a doctor say, let me just go look it up on a video, or I've never done this before, or this is my first time. You don't want to hear that. Every doctor needs to be trained appropriately for the procedures that they do. Like myself, I've been trained specifically for the procedures that I do in the emergency department. If I'm not credentialed to do something, I shouldn't be able to do it, and I shouldn't do it.
And you're about to perform leg surgery.
Oh no. Let's see what happens.
He's been in there an awful long time. I hope everything's all right.
I'm assuming it's going to take a long, long time.
The new Joe Swanson.
Oh my gosh. Whoa! I see the leg. Look at him. He's so standing proud and walking.
Well, what do you think?
It's a miracle.
Great, Joe! Holy crap!
They still got that new leg smell.
I put his old legs in a bag if you
Oh,
want.
that's messed up. That's messed up. First off, it's a miracle that that happened. Again, with spinal cord injuries, the limbs are not the problem. It's the connection to the limbs. But the fact that they saved his legs and give it to him, I don't even know if you can request that.
Stay. Sorry, I couldn't find a sitter.
Okay, wait a second. So there are actually dogs that can go into the hospital. They're basically like companion dog that somebody has to have. They can actually sometimes be admitted to a hospital. Sometimes depends on your hospital.
You all have the flu. But luckily, you got here in time.
Doc, this is very important. How long before she can make dinner again?
That's messed up.
Peter, you appear to have a very strong immune system.
Sometimes people will be around a lot of sick individuals and not get sick. I, for myself, right, being that I'm an emergency room doctor, I'm always around people who are sick, and I very rarely ever get sick.
Anyway, this flu season has decimated the hospital and we're severely short-staffed. How would you like to be a male nurse?
Do I get to wear those green pajama clothes all day?
Yes.
I'll do it.
So he's going to be a male nurse without any training.
Give me 20 cc's of Music Factory. Clear. Again, clear.
These are your defibrillator paddles, okay? Most hospitals nowadays actually have electrode pads that just stick to the chest instead of paddles, but some places still have the paddles. And if somebody's in cardiac arrest or pulseless and they have a rhythm that is shockable, you don't shock everybody. Typically, there's only 2 rhythms that you shock: VTAC or VFib when they're pulseless and unconscious. So he did 3 shocks in a row. That is actually an old protocol that's not used anymore. Typically, it's 1 shock CPR for 2 minutes, recheck a rhythm, and then also typically you're using epinephrine at the same time every 2 to 3 minutes.
Lois, I weigh the same 293 pounds today that I weighed in grade school.
You can actually weigh the same amount, but actually have more subcutaneous fat, right? Because fat and muscle weigh different. So you can be 293 pounds of all muscle, but you can also be obese because of the amount of subcutaneous fat that you have and even organ fat that you have.
Perhaps it's this lump on the side of your neck, sir.
Oh my gosh. It's kind of really lateral on the side of his neck. So it could be like an aneurysm. It could be a mass. It could be cancer. It could be a lipoma, which is a fatty tumor.
We gotta go see Dr. Hartman right away. I think it might be a tumor.
Okay, let's have a look. Oh, yes. It appears you have a subcutaneous vestigial twin growing on your neck.
There are things called teratomas that are remnants of hair and teeth that are found in the body, typically in the abdomens, but could be somewhere else in other tissue. But this weird twin that's growing on his neck, unlikely.
Hi, everybody.
What the hell is that?
Oh, my God. It's a little me.
That is awesome. Okay, I've never seen this in real life. You would never just go in and just cut this open. You would probably end up starting with a couple different images. You might do an ultrasound, you might do a CT, and then for soft tissue things, you get an MRI. An X-ray is probably useless in this situation. And then once you determine what it is, you may want to open it up and see what potentially is on the inside.
The fertilization device is complete. This will impregnate me with the child that will bring Brian and me back together. First, I add Brian's hair and saliva.
Hair and saliva, good, right? It's got some DNA that you can extrapolate somebody's DNA from.
Yeah, you watch me, bitch.
Gosh. What? You can't just inject straight into the abdomen. There's no place then for the baby to develop. It needs to be inside a womb. And what the womb is, it's the uterus. And typically a uterus is an organ that is in a genetically made woman. Probably unlikely this young boy doesn't have a uterus. I don't know if he does or not, but genetically he shouldn't.
Oh my God, that thing's positive. Is Lois pregnant again? What have you done?
I think you mean, what have we done, Brian? We're pregnant.
Oh my gosh.
God!
The urine pregnancy test tests for beta-HCG or HCG, which is human chorionic gonadotropin hormone. And it's actually most of the time released by the placenta. It could also be released by the pituitary gland, colon, liver. Because sometimes a man can actually test positive in a pregnancy test, but it typically doesn't have to do with pregnancy. It could be concerned for like a different type of cancer. Not too far-fetched that Stewie can potentially test positive on a urine pregnancy test.
You look ridiculous like that.
Too ridiculous for you to put a baby in me.
Okay, Raylene, I'm Dr. Hartman.
Let's see where this actually goes, because Stewie doesn't have the female genitalia.
Your vagina seems to have a penis and 2 testicles.
Oh, right. I
There you go.
sneezed real hard and all that came out.
Ah, that explains it.
He sneezed really hard. It doesn't typically work that way.
Could you do that thing where you take some fluid and tell me if it's going to be an imbecile or a creep?
There's actually procedures that the doctors can do, amniocentesis, to identify things earlier. Typically, they do these to make sure that genetically the baby is okay, that there was not any inborn errors that they would be concerned about, any chromosomal errors, that sort of stuff. There's always a potential risk of causing miscarriage or infection when you do these procedures, but very, very low, and people typically do them.
I'm sorry to inform you that Brian has a brain tumor.
Oh no! You can have a tumor in the brain, or actually even like skull fractures that can cause bloody noses as well. That's a lot more serious and dangerous in the sense that now there's a communication between your nose and your brain itself, increased risk for infection.
So, Doc, how much Jamba Juice do I have to drink?
Oh, he's
to
still
cure
intoxicated.
This? I've also heard that, like, crystals exist.
Crystals work on the idea potentially of healing powers, but most of the time it's probably more related to a placebo effect. Do you use crystals? Let me know in the comments.
But I say we get that tumor out of him right away before he gets any dumber.
So if Brian doesn't have the surgery, will he be all right?
No way. I'm never going back to my old self. Brian could have the surgery and be smart again, or he could skip the surgery and stay dumb like this.
Okay. So the concern is not that Brian will stay dumb. He's not dumb. It's a brain tumor pushing on his brain. It could continue to expand. So you want to address the swelling of the brain, and if there is swelling, it needs to be removed. Sometimes you can give steroids to temporize the problem, but a neurosurgeon needs to evaluate this for surgery sooner than later.
You know what? Hang on. I left my harmonica in the tub.
I think Peter's in there taking a bath.
Ah, son of a bitch! What the hell did I just sit on?
Where is it? Where's my harmonica? It's not here!
Peter, have you seen Stewie's harmonica? It was in the...
Of course.
Oh my God! It was in the tub, and now it's in my butt.
You know how many times we get in the emergency department, somebody comes in and they sat on something and it went up into a certain area? It's pretty hard just to sit on something. You need to be able to relax the muscle. The sphincter, which is the muscle around your butthole, it's tight.
Stewie, Daddy needs your tiny hands for a very special project.
Tiny hand. Oh my gosh. You can attempt to get it out. It is very painful. Sometimes you can get it out in the emergency department. Sometimes you actually have to go to the operating room. At the hospital, there's the harmonica. We do get x-rays looking for alignment, looking to see how far up it is with the orientation, those sorts of things. If it's too far up to where you can't reach it with your hand, you have to go to the operating room. Or worst case, they have to actually open you up.
Can we address my husband's situation?
Well, the harmonica's up there pretty good. Unfortunately, removing it would require a very expensive surgery that's not covered by your TGI Fridays gift card.
Oh my gosh. Potentially an emergency because of risk of bowel perforation, but a harmonica could get snagged, can cut.
I don't know. But suddenly it smells like John Popper in here.
That was me. I got musical farts. Holy crap.
Holy crap.
I will not allow this opportunity to go to waste.
Don't put anything up there, like I always say, without a string or a big flange.
We should start by checking your reflexes.
Ah!
That is not what you mean by checking your reflexes, okay? Checking your reflexes, your DTRs, your deep tendon reflexes. That's when the doctor used the hammer. The classic places like the knee, the patella tendon. You can even do it on the forearm, for the wrist as well, but not just trying to scare somebody.
But you gotta help me. My arm really hurts. It all started after I got a chainsaw.
Is that right? Well, it sounds to me like you may have chainsaw elbow.
Okay, no, there's no such thing as chainsaw elbow. What they're describing most likely is tennis elbow or golfer's elbow, which is medial or lateral epicondylitis, which is just inflammation of the tendons in those anatomical positions.
Chainsaw elbow?
So how much synthetic opioid do you need?
That is so messed up. Basically, the best medication for this would be an anti-inflammatory, which is ibuprofen. Opiates in this setting just covers up the pain and actually doesn't fix the problem.
I'm trying to prescribe enough to earn a fanny pack.
I don't have any specific medication, brand, generic versus trade. I think the only thing nowadays that pharmaceutical companies actually end up doing is educational teachings with maybe a dinner or something like that.
Have you ever had a chiropractic adjustment?
What's that?
It's a procedure where a guy who couldn't get into medical school tries to rip your head off. Worse.
That's messed up. So chiropractors are their own specialty. They not just crack or realign people. They also do wellness and health optimization. They go to school for a long time as well. They chose this career. They did not make it into med school.
It's kind of like the Polar Express.
Let's do it.
Okay, I'll give it a shot. But this type of thing is usually done in strip malls next to a Little Caesars.
Unless he was trained on a separate course that he took on his own, he shouldn't be doing this. He needs to know these techniques. We spend many, many, many hours learning how to do this. Oh gosh. Oh my gosh. Oh, that's not how you do that. horrible.
Holy crap, what happened?
Well, I think we simply found your true height.
Okay. So you can actually do cervical decompression basically by pulling on somebody's head, by lengthening it. So it takes some of the pressure off where the nerves are coming out, which could be causing compression of the nerve, which then can be causing symptoms to your extremities and your pain and that sort of thing.
Got you now, Bat Daddy.
Okay. So bats could carry rabies, okay? And their bite is so sharp that you may not even notice it if you're sleeping.
What is it?
Ah!
Oh! There's always the potential that they might have bit you. The concern, though, is it could, and if you get rabies, it's pretty much deadly. What ends up happening is you would go to the emergency department, and if you know where you got bit, you can get immunoglobulin to protect you, and then you would also get the rabies vaccines.
Peter, what the hell did you do to Stewie's hand? It could be broken.
Oh, no.
I didn't mean to.
You're trying to hit the bat.
Sometimes I don't think before I act.
Stewie needs an x-ray of his hand to see if there's a fracture, and then we did see some blood, so is there a laceration that needs to be repaired?
Good news. Stewie's hand looks fine.
Oh, hey, high five.
And in kids, depending on their age, not all of their joints are totally formed, so there's a lot of cartilage that is still there that you can't see on an x-ray that it will future form into a bone.
Stewie hasn't had his vaccinations yet. Should we take care of that?
Well, I suppose so.
Oh, but first, I'm required to have you read this pamphlet about the risks of vaccinations.
Possible side effects: fever, severe allergic reaction, muscle and joint pain. Wait, and this can't be right.
A lot of good things about vaccines. Vaccines are not without risk, okay? There's always a chance of something happening. Every human is different. We all have potential different reactions, but risk versus benefit.
Hey, man, how many questions your lady asked?
Oh, geez.
Million?
But I don't remember having to read any of this when Chris and Meg had their vaccinations.
Well, that was before internet chat rooms made everybody an expert.
Well, okay, so that was a big dive into vaccinations, especially now what's going on in the world. So vaccinations are a good thing. Vaccines have been developed to help eradicate a lot of different viral issues that we've had in the past.
What are you, nuts? I got no special
Right a bar.
talents. Well, what can I do that nobody else does?
Well, you just ate my tip.
Oh,
I got it.
what is he gonna do? What is he gonna do? All right.
Oh my God, Lois! I can't see!
Uh-oh. So a lot of times when I've seen patients where they literally just can't see, it's actually due to diabetes or sometimes brain tumors. So definitely needs to be seen.
How about now?
Nope, nothing.
Well, that makes me feel much better. You can't see the spaceship either. My cousin Marshall
Oh, my
insists
gosh.
if you look past the picture, you can see us.
Normally you'd use an eye chart, but even then, if you can't see the letters in the eye chart, then you use big objects, then you check if you can see waving objects, and then can you see light or not.
Can you please just tell us what's wrong with my husband?
Oh, yes. Well, you see, after ingesting such a large number of metal coins, Mr. Griffin appears to have succumbed to nickel poisoning, causing him to lose his sight.
Oh my God, Lois, I'm blind as a bat! I can't see a damn thing!
The likelihood that the nickel from the nickel is causing blindness is pretty rare. It causes a lot of other things, more GI symptoms, skin symptoms, maybe some neurologic things, but it doesn't typically cause eye blindness. Some other toxicities could.
Okay, Mrs. Griffin, tell me what you see.
I see a cow in a lab coat, some vultures in a cowboy hat, and a dog trying to trick a cat into a clothes dryer.
Just as I thought. You're far-sighted.
Boom. Doing your visual acuity test, you can do shapes, letters, but typically it's not images, and it's a certain distance away, and we know how good this doctor is.
I would say you either need to get glasses or maybe LASIK.
Is that the surgery people get and then tell everybody they got it?
Yes, it's the veganism of elective surgery.
Yeah. That is so true. You'll definitely know if somebody's ever had LASIK before because they'll tell you. But they're super excited about it. They have better sight, so why wouldn't they want to share it? There's LASIK, there's PRK, there's other type of different surgeries, but it's all related to the cornea itself, actually changing potential thickness of your cornea, which then has to do with how well you're seeing.
If you're unsure of what to do, here's a video of Radiohead frontman and super weirdo Tom York to help you decide.
Not many people know that I'm blind in one eye. Can you guess which one?
Fine, I'll get the LASIK.
Great. Make an appointment with my nurse. Now here's a lollipop from the Sackler family that says, sorry.
I think this doctor's a general doctor, family medicine doctor. This doctor does not perform eye surgery unless it's an ophthalmologist. And then the whole Sackler reference, so I'm not sure if everybody understands, but Sackler family owns Purdue Pharma. Purdue Pharma has to do with producing opiates, and they're almost being sued by every single state in the United States for having their hand in, producing the opiate epidemic per se.
Mrs. Griffin, the surgery was a success, and by that I mean the hospital agreed to take your Discover card.
Plus, we'll get 1% of that back, which is basically like getting nothing.
Oh my gosh. Obviously ripping on the hospital because you have to pay for the services, especially in the United States. But in other countries, sometimes you don't have to do that, and it's just services are available and are free of charge or paid in your taxes that you paid, all that stuff. Bandages are off. And the clarity of vision is...
Oh my God.
She can't see.
I'm blind.
What?
But you can still see, like, the stove and laundry, right?
So listen, disabling vision loss where you're like seeing black is very, very rare in LASIK surgery.
Yeah, come on, Quagmire. Get the hair transplant. Come back to us.
You're right. This isn't me. Baldness is for women's crotches, not men's heads.
There you go. That's pretty close.
Hair transplants are a thing. You can take good hair and you put it back on the head, but I have seen a lot of people fail where they have like this huge big strip of hair missing in their back and they're bald on top. Now you can also take medications to try to keep your hair before you lose it.
Glenn Quagmire? Why does that name sound familiar? Oh, yeah, I treated you for butt flu.
You want to keep it down?
I don't really know what butt flu is. It's not a diagnosis that I've used, and it's not an ICD-10 code. Maybe it's like diarrhea or something like that. But flu in general, body aches, the viral illness, cough, runny nose, those sorts of things. So of the butt, is that what they're trying to reference? It's not a thing.
How's it going, Dr. Kamada? Bob. Mate. Jim. Marion.
Yeah, that's not good.
Jeez, Joe.
Yeah, I come here a lot.
As everybody has told me, Joe didn't get paralyzed from a spinal injury. His legs got all shot up. So he's probably had multiple surgeries, had to go to the hospital a lot. And over time, you actually develop relationships with the people that you are there with and that are helping you recover.
I now declare this hair transplant officially over.
What?
Hey!
What is this doctor? I've seen him do LASIK surgery earlier today. Now he's doing hair transplants. No, these are doctors of these different surgeries are specialists, not general practitioners.
Hey, he's back!
You look great, Quagmire.
Oh, my God. One of my patients on 2 has been shot.
Oh my God. But now he's got a GSW upstairs, shot through the floor. And then it's a trauma. You know, at the trauma hospitals that I work at, if you're shot in certain areas, hand or below your knee, and it's just soft tissue wound, you're not even in trauma activation. Wound care and follow-up.
Is the Brown family. Oh, my goodness. I'm so sorry. Sometimes I write descriptions of my patients to help me remember them.
No, it's okay. Our last name is Brown.
Dr. Hartman, what are you doing, buddy? Like saying things like that out loud. Like, okay, sometimes we have little triggers that help us remember things using patient identifiers relating to skin color or any other physical identifier should be used. If he's referring to the Brown family, then that would be accurate. Let's see where this goes, Dr. Hartman.
Oh, okay. Phew. Then this must be Chubster Dum Dum.
What? Chubster Dum Dum. Totally inappropriate. And don't say that out loud. That's not cool. The kid obviously is a little overweight. Don't call somebody out about that after they've had like injuries. You have a discussion about their weight if they need to have a discussion about their weight.
I'm sorry, sir. No visitors.
Excuse me. I'll have you know I'm the shooter. So, how's he doing?
How's he doing? How do you think he's
What did he
doing?
do?
You shot my son.
So actually in the hospital, when somebody actually comes in to the trauma center who's a gunshot victim, they're actually not identified. The people taking care of them will know their name, but on the board or for visitors, the names are left off. So you can't actually identify who the person is, because if this was like somebody trying to kill somebody, they potentially would try to get into the hospital and try to finish the job.
Calm down. I want this racist out the room, and I want him arrested.
Racist? I put these gloves on.
I've had patients come in and they put their hand out to me and literally you can see feces in their fingernail. Like, this is not a joke. Like, it does happen.
Sorry, I just prefer to do number 2 at home. Where were we?
I'm just gonna say this because I'm gonna say it. He talked about going to the bathroom. If you feel the urge, you need to go to the bathroom, please go to the bathroom. Don't try to suck it back up in there and wait for another time to go because you're gonna be behind in the amount of poops that you're gonna have. You're gonna increase your risk of diverticulosis, which then future increase your risk of diverticulitis and perforated bowel.
It's Stewie, Dr. Hartman. He's having trouble focusing at school.
Ah, yes. So you're telling me your baby won't sit still in a way that's convenient for his teacher?
Yes.
I'd heard stories, but never thought I'd see it with my own eyes.
Babies crawl, babies move around, babies don't really listen. I don't know how old this kid is, but if he's acting like a normal child, he should be moving around.
I'm going to write Stewie a prescription for ADHD medication.
Oh my gosh.
I don't know. Doesn't that stuff make you wired?
Come on, doctor. Like, what the heck? You're trying to prescribe a stimulant to an overactive person who's highly stimulated. Obviously, it works for some people because that's why we have the medication. Our first go-to as healthcare providers and teachers and parents should be to address the problem and try to figure out from behavior modifications to get the kid to focus or figure out why the kid's not focusing before jumping to drugs as your first line of treatment.
Well, if you're low energy and lethargic, yes. But if you're high energy, it actually calms you down and helps you focus. At least that's what I'm reading on WebMD. A lot of different kinds of medicines.
There's a cat in here.
Okay, I guess we can give it a try.
Here you go. Now, who's this little guy?
Oh my god. The doctor's not even like paying attention. He's looking up things online. Obviously, sometimes you have to look up dosing, when to start a med. That's okay. Obviously, doing it in front of the patient, like, fine if you're having a good open relationship with them.
We're late.
Whoa, Peter.
What the hell?
Why does he look so
Peter, it's
sunken?
horrible.
Other people live here.
Oh my God! How did this happen?
It's from smoking.
Not that bad.
Peter, you can't live like this.
If someone's been smoking for a long time, it's messing with the vocal cord, so you can actually hear it in their voice. And then their skin, it's like tight, leathery, wrinkled. You can tell. When you stop smoking, it'll take a very, very, very long time to get back to normal.
Dr. Hartman, we're here for you to help Peter quit smoking.
Mrs. Griffin, I can't do that. It's an addiction.
Well, there are multiple ways to actually stop smoking. He's calling it an addiction. It's more typically like a habit. You could be addicted to the process of smoking, going outside, taking a break. You could be addicted to the nicotine.
He's killing himself.
Ugh. All right, how many Vicodins for you guys to just leave me alone?
Oh my gosh. Wow. He's just like, well, let me just give you some Vicodins. We have an opiate crisis in the United States and around the world. Not something that you should replace it. But it's pretty crazy because opiates in itself affect a part of your brain that have to do with serotonin and dopamine, leading to anxiety, depression, which is part of also the reward feedback system related to also smoking cigarettes. People might actually feel better, but it's a totally inappropriate way to treat somebody trying to get off of an addiction.
Well, it's too bad Dr. Hartman couldn't help us. I guess we should go to the Stop Smoking clinic and then maybe get a couple bottles of wine.
Oh my gosh. Some people have personalities that are addicted. There are multiple things that you can do to stop smoking. You can do Nicorette gum, you can do lozenges, you can do a medication, and then there's also the idea of nicotine cartridges if you do vape to slowly decrease the dose of how much nicotine you're getting.
Check out how hot my last patient was.
Oh my gosh, totally inappropriate. Like, this is so disturbing. I have my phone in my pocket to get phone calls from the hospital. I occasionally, with the consent of a patient, written, take a photo of maybe an injury that I can send to a specialist so they know the injury, and it's all no patient identifiers. It's via an encrypted program, and that's only if we have to do it.
According to this projection, Stewie's adult height will be 5'1".
What?
5'1".
You go to the doctor's offices, you potentially can get a prediction of your height. Obviously, this is not something that is highly scientifically accurate because things can change. Growth plates can stay open longer, they can close sooner. Sometimes you can get an x-ray and it'll show your growth plates are still open when you're a little bit older and be like, oh, I'm actually still growing.
I mean, I suppose it's fine if he's gonna die at 14. Is there anything on there about that?
Well, we learned in medical school that the short ones do go faster because they smell more farts than the rest of us.
Oh my gosh. That actually is kind of funny, but totally not true. Actually, longevity studies have shown smaller people in general, not massive bodybuilders, but people who are just smaller in general, will actually live longer. And it potentially has to do with, if you're larger, you're asking your body to work harder and almost do double the work as somebody who's half your size.
This is terrible. I can't be short. I'll be an outcast like Rudolph the uncircumcised reindeer.
What? Rudolph the uncircumcised reindeer? I've never heard of such things.
All right, it's Dasher. He's been complaining, and he is the one who has to look at him.
I don't know. Mrs. Claus says it'll decrease my sensitivity.
Oh my
I'm sorry,
gosh.
why are you talking to my wife about this?
Yes, by being circumcised, it does decrease sensitivity a little bit. Your higher chances of having an infection with an uncircumcised penis because you can get bacteria trapped underneath. If you don't clean it well, then you increase your risk of phimosis and paraphimosis. So there are multiple reasons why one would want to circumcise himself, not just because somebody has to look at it.
Oh my God, what happened to your face?
Oh man!
Stewie? Hello? Who's there? Sorry, Brian, my
You can't even
eyes
see
don't
anything.
close when I sleep, and I'm blind for a few seconds when I first wake up.
Stewie, you got more plastic surgery?
I know it was a mistake.
I told you not to do this. You're way too young to be getting plastic surgery.
Yeah, 1-year-old. Oh my gosh.
I think one of the cuts got too close to my brain. Brian, school pictures are in 2 days. What am I going to do?
So the question is, what do you have done? It looks like you got lip filler, face pulled back, and then probably some Botox in there, but he can't close his eyes. Typically, if you actually get Botox near your eyes, your eyelids, it'll probably cause him to be droopy because there's no muscle tension. And if it does happen, it will go away. And maybe babies shouldn't be getting Botox or fillers.
He needs you to help fix his face. Oh, absolutely, I can do that. Great. Is it a simple procedure? Oh, sure. We just break every bone in his face and then smush him back into position.
Oh my gosh.
Dr. Hartman, where'd you get your medical degree from?
God.
He told me bed rest and ice packs for 2 days so it can set, but I'm not missing picture day.
2, 3.
Oh! I don't know what kind of procedure that was. Did he break his bone and try to smush everything back together and rip the seams? Horrible. I didn't mean to say facial droop in this capacity. There's a lot of connective tissue underneath the skin. So yes, if something kind of rips open, lacerates open, everything else is still intact. It all just doesn't fall off. Please be careful with injections, fillers, all these different things. Go to a reputable place. Go to a sound place. Don't go to the place that's the cheapest or the best deal, because sometimes you get a bad deal.
I never told you this, but for years now, I've been planning on retiring at 45 so I can work on finding a cure for Alzheimer's disease.
Alzheimer's disease. Alzheimer's disease is not a disease, but I'm assuming it's related to forgetting your testicles.
Peanut, are those testicles? Where did you get those?
I don't remember!
You got Alzheimer's disease, which is a type of dementia. Dementia is basically slowly losing your memory, not able to form new memories. There's multiple different kinds. Oh, he's in the hospital. First glance, these injuries are related to either a car accident, a fight, riding a bicycle or a skateboard or a scooter, and he fell and hit his face. Those are kind of the first things that you think of.
Mrs. Griffin, I have some good news or some bad news, depending on how you feel about your husband. Do you love your husband?
Yes.
Mrs. Griffin, I have some bad news. Your husband is brain dead.
We don't present things this way. You don't say good news, bad news. You just say this is what we found.
I'm afraid it's time for you to make your choice.
Make your choice.
Are you telling me I should pull the plug?
I'm afraid so.
Typically, if there's no brain function, then you actually wouldn't have the function to breathe. So you should probably be on a ventilator. Pulling the plug officially means turning off the mechanical ventilation. If their brain isn't functioning to tell them to breathe, they will die pretty quickly right after that.
Also, you might be getting a call about the service you received here today. Do you feel I've earned all 10s?
We, as physicians, are judged by the government based on surveys that patients do. It's called a Prostate score in the emergency department. Do we address all the concerns? Did we address your pain? Basically, just hits the things that we should do.
I don't want to go!
Hey,
Hey.
That's a plug. You pulled the plug on me?
Oh, what? Oh, man, Lois. Actually, sometimes things like this happen. Usually, it's from GHB, the drug which people become totally unconscious, and then once it's metabolized out of their system, they just all of a sudden wake up. They rip their endotracheal tubes out.
Peanut, it was a very difficult decision.
How could you do that? I'm alive!
I'm here from the mortgage company. Mr. Griffin, you're 3 months late on your payment.
So that is a tough conversation to have. That flatline noise that you hear in movies is most of the time just a fake idea. You hear the bloop, bloop, bloop. We don't hear those at the hospital either. It would just be a ton of different noises all over the place. He's got a pulse ox monitor on his finger, and he's got an IV in his right arm in the antecubital fossa, so good job. At the hospital, obviously. Lois, you're freaking out.
Don't worry, Lois. I went blind a while back.
Oh.
It was cool.
Dr. Hartman, you said there was very little risk to LASIK, but now I am blind.
So Lois is blind after eye surgery. Sometimes you can have a lot of edema and swelling to the eye itself. So that can cause temporary blindness. At that point, anytime there's blindness, phone call to an ophthalmologist, potentially get a CT scan of the head to make sure there's no mass or no injuries. And then the ophthalmologist needs to see these patients.
Okay, look, this isn't my fault. It was take your cat to work day.
I love that the laser the cat was using to run around and try to get. So you wouldn't do it freehand like that. Animals in the hospital, yeah, that doesn't happen. We do have in certain hospitals therapy dogs, but not a random bring your animal to work day.
Get that cat out of here.
They're not sterile, they're dirty.
Until she gets used to her new life, you'll need to take care of her. Feed her, bathe her, drive her places.
They're gone, aren't they?
They left, yes.
Wow. There are times when we see family dump their member into the emergency department and we can't contact them, and then we have to figure out what to do with these individuals, and then that's when you actually get law enforcement involved.
Sorry to keep you. I was reading this Highlights magazine in the waiting room.
Oh my gosh, I remember those Highlight magazines. We got some little baby x-rays up there. We got a sternal notch all the way down to the pelvis.
Dr. Hartman, were you able to tell anything from Stewie's x-rays?
Oh, yeah. Little guy's got scoliosis.
Oh my God.
Scoliosis is basically lateral angulation of the spine. You can actually just do an exam where you put your feet together, you bend forward. The ribs basically will then rotate one way or the other. So that is one way to do a quick assessment for scoliosis.
Oh no, am I going to be a big shoe, small shoe guy?
This doesn't typically have to do with leg length discrepancies. It could a little bit if you're having pelvic shifting. You need to build up a shoe. A big difference versus like, do you need a little lift in your shoe? Those sorts of things.
But don't worry, he'll be fine. He just needs to wear this brace for a while to correct it.
Oh, dear.
Now, does he have any school pictures coming up?
Yeah, he actually does.
Well, then this will not be a refrigerator door year.
The braces that we use at the hospital that I see are something called a TLSO brace, and it has to do with the different areas of your spine. Typically, it's used when there's like a fracture versus misalignment.
What the deuce?
Uh-oh.
Brian!
Yeah! Oh my, what? He has such a massive head that the sound of his head hitting the stairs is actually a really good job.
It's got to be from wearing that damn brace all the time. Your neck must have atrophied so much it can no longer support your head.
There you go. We do tell people with the soft cervical collars not to put those on because you can actually cause muscle stiffness and potential atrophy. Say you have a shoulder sling. You got to make sure you take it out of there and do gentle movements. If you use it all the time, you can actually cause yourself frozen shoulder syndrome.
You've got to take me to the hospital. Absolutely. Let me just watch Jennifer's body and we'll go right there.
If you have neck laxity or you injure your neck, make sure you stabilize it. Wrap a towel at your house and roll it up and put it into almost like a horseshoe and put it in that area. You can tape the front.
Ow! 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 My balls!
What is he doing?
Oh, the other ones. Ow! Ow!
Oh my gosh. Thank you, whoever wrote this, for calling out Peter's ball sack chin. We all think it every time we look at him. You have the space for a male between your ball sack and your butthole called your perineum. This area has specific nerves and blood vessels that can get compressed. If you've ever gone on long bike rides and everything feels numb down there, it's because you're messing with your pudendal nerve. Oh my gosh, they took him to the hospital.
So what do you think happened to my voice, Doc?
Oh my gosh, this is great. It doesn't happen that way. Your vocal cords don't change tone because you got kicked in the balls. You might not want to speak because you hurt, but it doesn't have any effect.
Peter, I'm afraid you suffered something called Pendleton balls.
Pendleton balls.
Here's a video explaining everything.
Pendleton balls. A painful condition where your testicles get lodged next to your voice box.
Sometimes you can actually have an undescended testicle, or when it's very, very cold, the scrotum shrinks up and the testicles kind of come up in a little bit, but they shouldn't be going intra-abdominal. So no, your testicles cannot go right next to your vocal cords.
Don't worry. With the help of gravity, Pendleton balls will clear itself.
Isn't there anything I can do to help my voice get back to normal faster?
I don't know. I just like putting on videos.
If you have testicles that go inside, you need to see a urologist, and it's an emergency. You always worry about blood supply related to the testicles. And if you don't have blood, you don't have oxygen. If you don't have oxygen to the tissue's going to die. If that happens to both testicles, then you're going to run into the problem where you might become infertile. What the hell? He's stuck to the couch. It happens. It's almost like an open wound that's then healed into the couch. Somebody puts a bandage on you and then it dries and the bandage sticks to your wound. It's the same idea because the tissue is healing with that type of fabric around it.
You'll be fine. Here's a video to help you understand.
Oh my God, this doctor and his videos. No, just talk to your patient.
When a fat guy's sweaty skin presses against couch fabric for an extended period of time, the fabric fibers fuse together with the skin.
So, almost right. It happens to everybody. The idea that the fibers are being grown in, the fibers don't do anything. It's the body's uptake of them.
Procedure is called rip you off real fast. Very painful.
Ripping it off like a Band-Aid. As you rip it off, you're going to open up the wound.
Ready?
Actually, I've decided to keep the couch on me.
Really? Are you sure?
Oh, yeah, this is nothing.
Can Peter actually walk around with a couch that heavy around his back? He's going to have a lot of lower back pain. When you lift heavy objects, you need to lift with your knees, because if you bend over at all, you're going to put too much strain on your lower back and be in a horrible situation.
Peter, enough is enough. That couch is coming off.
Yeah.
You wouldn't put bandages around somebody's neck like that because you can cut off circulation to their brain. So he's on a ventilator, kinda how we do things. It's pretty close. They did a good job by how it's fixed to the face. We have something that has pads and that wraps around the tube so the tube doesn't move.
He's in what we call a coma.
He's not in a coma.
It's not a
Coma. And we don't even call it comas. We just say he's unresponsive. People can be in a coma for years. And then that becomes medical, legal, ethical situation relating to the family, patient, and the doctors that are taking care of them. Oh, we're at a burger joint. Nice.
Peter, you should really slow down. You've already had like 30 hamburgers.
Shut up, Brian. It relieves the pain of mustache.
Oh my gosh.
And it's working. I no longer feel the pain.
Oh, it's emotionally eating. I very rarely eat hamburgers. Typically when I do, it is very lean hamburgers.
Very lean.
Balanced diet is key.
Come to think of it, I can't really feel anything on the left half of my body.
Really? That doesn't sound good. Peter, are you winking?
Oh no, he's stroking out. Twitching.
God, someone call an ambulance.
Are strokes caused by diet? Not immediately. A long-term bad diet could lead to other medical problems, which then increase your risk for having clots.
Doctor, what happened? Is he gonna be okay?
Mrs. Griffin, your husband has had a stroke. The left half of his body is completely paralyzed.
Oh my God. Peter, sweetheart.
I love that his eye is totally drooped down. No, that wouldn't happen. Most of the time you see it in the lower part of the face. Typically the forehead is spared. That's also how we determine the difference between Bell's palsy as well as a stroke, because in Bell's palsy the whole side of the face is involved, including the forehead.
Had better days, Lois. Had better days.
He just has a motor function deficit. Sometimes you can have expressive aphasia. Somebody understands the words are coming into the brain, but when they try to say something, they'll say, "Hey, Dr. Wagner, how are you?" And I'll say, "Dog, cat, baseball." I don't think you should be driving. If you have a stroke where you have massive deficits, you're likely going to get your license taken away anyway or suspended for a short period of time. Typically, we do the same thing if somebody's had a seizure. You can't drive for 6 months unless you're cleared by a neurologist. Oh my gosh, why is he in the basement?
Peter, are you okay?
I was down there all night. So dumb.
So if he's down there all night sleeping on hard floor, you increase the risk of having muscle breakdown called rhabdomyolysis. You also are very concerned about kidney failure because the breakdown of the muscles clogging up in the kidneys.
Oh my
Why
God,
did he age? Look at the grays.
It turned white.
What?
Stress is one of the big ones that can actually cause that. I have grays. I work really hard, but a lot of times it's really a change of hair color is related to genetics.
Oh, how'd you get white hair again?
He was scared of a ghost.
Yes, I remember hearing about this in mid-school. Or was it a Scooby-Doo?
Dr. Hartman is the worst doctor.
What do I do now? I mean, should I diet?
Diet. Yeah.
I don't know why you'd ask me that. I mean, I don't know anything about that. How does one even go about dyeing one's hair? I've never heard of anything so crazy.
The guilt of dyeing her hair, Lois. It's okay if you dye your hair. It's fine. If you want whatever color you want, dye it. Get after it.
Let me get that for you, Doctor.
What? Oh, no, I'm not a...
Morning, Doctor.
Wow, Peter, they all think you're a doctor because you're white. I have to say, it does make you look more distinguished.
That's hilarious.
Really?
I will say, as a young physician, people call me by my first name a lot. You know, if I was older and I had gray hair, you wouldn't call me Jordan. You'd call me Dr. Wagner. At the end of the day, that doesn't really bother me.
You want a little something to put in that orange juice?
What? Why? It's 9 a.m.
Well, I figured you'd like to start your day with a stiff one.
You can't get a boner!
Oh, that's so messed up. They're referencing a morning erection. It's normal to have erections in the middle of the night, multiple times a night, but also we call it morning wood. That is normal.
You're a failure as a man and a father!
They're talking about giving him a stiff drink. If you drink too much alcohol, you're not going to be able to get a good, solid erection.
Peter, it's nothing to get upset about. There's treatments available.
If you're having difficulty with erections, there's multiple different reasons why that could occur. It could be your brain just worried about it. It could be decreased blood flow. It could be underlying medical conditions that are causing the issues.
Well, go see Dr. Hartman.
I don't want to do that. I'm embarrassed.
This shouldn't embarrass you. The size should embarrass you.
Oh my gosh. We all come in different shapes and sizes. The average is a lot smaller than everybody thinks, and most people are actually normal size, so don't worry about it.
How about now? Is this doing anything for you?
No.
What? Not appropriate. You can get sued, lose your career, lose your license, D, all the above. Does not happen in the hospital.
Doctor, what about Viagra or Cialis?
You have all these different medications to help with erectile dysfunction. Those are fine. If those don't work, then you can actually do injections. There's always implants that you can get to where it's almost like a pump.
What about them?
Well, if Peter could try them, they might help with his problem.
If you ever go to the hospital and you had a heart attack or having chest pain, tell them you're on one of these type of medications, because there's a medication that we give called nitroglycerin that if we give it to you while you're on these medications, we can tank your blood pressure and potentially kill you. So please let us know if you recently took that.
Those are for man troubles? I've been prescribing them as antidepressants.
Wow, Dr. Hartman, come on. They actually started as blood pressure type medications. The research was going down that road. They found out that it causes prolonged erections and helps with flow to your penis.
I guess I see where some of your anger comes from.
This is like roller derby. This used to be on TV like a long time ago. I don't know if it's still on TV or not. Oh, that's messed up. At least she's wearing her helmet. The leg definitely looks a little uncomfortable. She's got some bruising already to her face. Like, uh-oh.
That's it. I have to do something.
Chris, what are you doing?
Saving my...
Oh! Oh my gosh. Being run over, you always worry about fracture of the hand. You can potentially get compartment syndrome where it's like swelling in an area. Then it actually needs to be cut open.
Dr. Hartman, is my brother going to be
He's
okay?
going to be fine.
That's her. That's her. Hi, Juanita.
Hello, Doctor.
Oh my gosh, totally inappropriate. Dr. Hartman is
weird?
so inappropriate.
You don't know. I was fine.
Looks like Chris has a cast on his left ankle and his right forearm. It's not even really on his wrist, because if you had a wrist fracture or a hand fracture, it would actually go all the way down to the fingertips.
We have to fight fire with fire. If nuclear refuse gave them superpowers, it could do the same for me.
We see all these movies where people get these weird superpowers because it manipulates their DNA due to like toxic waste or something from outer space. No, it doesn't happen that way.
Citizens, I'm off to the toxic waste dump.
Radiation exposure definitely is not good for your cells. It could kill your cells. It can cause them to mutate, and a lot of times too much mutation could cause to cancer or abnormal growth. Oh geez. Oh, this is not going to be good.
Mayor West, you have lymphoma.
I told you! Lymphoma, which is cancer of your lymph nodes. There's different types of lymphomas, and then lymphomas can turn into leukemias. So, yeah, not good.
Oh, my.
Probably from rolling around in that toxic waste.
I see.
What in God's name were you trying to prove?
I was trying to gain superpowers.
Well, that's just silly.
Silly, yes. Idiotic, yes.
There are many situations that I've been in where somebody has tried different alternative therapies, and then we talk about it, and at the end of the conversation, it was like, well, that probably wasn't the smartest thing.
All right, Mr. Quagmire, I understand you have the hiccups.
Oh my gosh, we deal with this all the time. People come to the emergency department with hiccups that just won't go away. Main medication that we use is something called Thorazine and have had very good success.
Now, it says here on your chart you've tried boo. Outside of that, the best way to treat hiccups is through hypnosis.
I guess there's an option for hypnosis. There are a lot of different techniques that you wouldn't think to do for different medical problems. When somebody has something called supraventricular tachycardia, sometimes if you just splash somebody's face with a bucket of ice, it actually can fix it. It just has to do with shocking the system.
My mama always said that hiccups are a sign that the devil's got a hold of you.
Oh my gosh, no, it is not a sign that the devil has a hold of you. A hiccup is an involuntary contraction of your diaphragm. It's spasming for some reason. There's multiple different reasons why it would spasm, but ultimately it is your diaphragm, the muscle, that's causing the issue.
Satan, release your grasp from this man. In the name of Christ, I exorcise thee, infernal invader.
There's a million different wives' tales out there, home remedies. I have a fantastic remedy that is not doctor related. Put each finger in your ear, tilt your head back and have somebody pour you a glass of water and just continue to drink the water until you can't really drink it anymore. It always goes away. Oh, bottle cap? Oh no! Oh, snap neck, fractured jaw right there. Oh my gosh. How many of you out there skateboard and have gotten stuck on something so small on the ground that it catches the wheel, doesn't allow it to roll, and you just fly? Ouch. Okay. A lot of times when people land on their chin, we actually see a laceration that occurs. A big thing you always worry about too is if you hit your lip or your tongue in between your teeth that you actually bite on it and then it actually does a through and through laceration, which can be a little bit complicated. Oh, it's the running of the bulls. Oh my gosh. That is such a dangerous thing. You really got to be careful when you're doing that. That type of impaled injury could lead to permanent disfiguration. Obviously, in his case, he's not able to use his legs from previous injuries, but you always worry about infection. You know, you got to clean that wound out.
Oh my God!
Oh my gosh.
You all right?
I can't feel anything below my neck. I can't move a muscle, guys.
That's not good, but he's able to breathe, which is actually very good because your diaphragm is innervated by nerves 3, 4, and 5. And there's actually a funny mnemonic that we say 3, 4, and 5 keep your diaphragm alive. Oh, wow. That's a halo for cervical fracture. Literally, the 4 points that are circulating around his head are screwed into the skull. That way you literally cannot move. It needs to heal, and you're put in this apparatus.
Mr. Swanson, I did an exploratory procedure which revealed extensive damage.
Please just tell me, am I completely paralyzed?
I'm afraid of ghosts.
He's afraid of ghosts.
I'm afraid of no ghosts.
Sometimes in the initial phase of somebody getting bad cervical injuries and spinal injuries, there's a lot of inflammation and swelling. It actually behaves like you were fully paralyzed, but sometimes when the swelling goes down, there is actually a chance you regain the function of the area that has been paralyzed for a short period of time.
And yes, Mr. Swanson has lost all movement and will require around-the-clock care.
Around-the-clock care, mostly discussing meaning like peeing, pooping, cleaning, all that stuff. So we do it to babies all the time, and we do it to the elderly population as they get older, so it's just a part of life. It's a fact that we all have to deal with.
If there's anything I can do.
There actually is. Could you collect my mail forever? I'm leaving Joe and moving to Europe. I didn't sign up for this.
Wow, that's messed up.
That's messed up.
When somebody you love gets injured and then you just ditch them. Not cool, don't do that. Definitely have conversations with social work, a psychiatrist, psychologist, and work with the individual. Nice. Oh, wow. With boxing injuries, we typically see somebody might have a broken nose, potentially cauliflower ears, hematomas to the ears themselves. You got to be really careful of repetitive hits to the head, which can cause increased risk of bruising and then increased neurologic problems in the future. Just be careful out there and protect your noggin.
Ow.
Well, it's broken all right.
That's so messed up. That hurts, but actually when you do that, you can actually feel crunching of the bones. The biggest thing you want to make sure is that it's straight. Typically, it heals pretty well when you put it right back where it needs to be.
If you don't want to fight anymore, you don't have to.
Well, good.
Oh, I love you, Lois.
I love you too, Peter.
Is it cool if I tell your insurance that I gave you heart surgery?
Oh my gosh, Dr. Hartman. We just do our job in the emergency department. We order the tests that we need to test, the studies that we need to do. We don't know specifically if somebody has insurance or not insurance at that specific time.
So, Doc, I figured if Charmise and I are going to live as man and wife, I ought to get her checked out.
Of course.
What? This is a very inappropriate, weird situation. You actually wouldn't put the patient in stirrups like this, and most likely they're facing the door. So if somebody accidentally walked in, they're just, everybody sees everything. You wouldn't do that. It'd actually be turned around. They're in what's called the stirrups. The stirrups basically change the angle of the pelvis. The reason why you actually have the angle of the pelvis change is because of the uterus, the organ that you're looking at. You're looking for the cervix. You're trying to feel the uterus as well as the ovaries on each side.
Charmise, when's the last time you had a pelvic exam?
When was the Missouri Compromise?
Yep, there are definitely scheduled times of when somebody should be getting pelvic exams. The frequency just depends on your activity and age. But in the emergency department, we do them emergently. Typically, if somebody's having a significant amount of vaginal bleeding, if there's vaginal discharge during pregnancies, or if there's any pain or injuries down in that area as well, we'll do pelvic exams.
I think 1821.
Then I've never had a pelvic exam.
What?
All right, I'm going in. If I tug on the rope twice, that means pull me out.
The rope is inappropriate, but it's putting on a hat that has a light on it. It's quite helpful in certain situations.
God, who are the pigs who just throw their empty beer cans down here?
If you're having any procedure where you're going to get that significantly close, you should be gowned up, wearing gloves, depending on the sterility of the situation that you need. Does it need to be clean versus sterile? Oh, wow! He walked and snapped his bone, and it's tenting through the skin. It didn't pop all the way through, so it wouldn't be called an open fracture. It's still a closed fracture.
Holy crap, Brian, you okay?
How's it look, Doc? I'm sorry to say you have hip dysplasia.
What's that?
Oh, hip dysplasia. So it happens with dogs, typically not seen in human beings. Brian's leg is potentially shortened and externally rotated. Depending on where it's broken, the orthopedic surgeon will use different types of hardware or metal to reattach basically your leg to your pelvis.
I'm not sure what dysplasia is, but I do know you don't often see a Y that far up in a word.
There are some times when a doctor may not know the exact origin of a medical term, but hip dysplasia is basically a term that we use relating to the abnormal growth and some gentle abnormalities relating to the hip, which then could lead to fractures, dislocations.
I took the liberty of x-raying my own hip to show you what a normal one looks like. Why does it look like there's a Batmobile in your colon?
That's good. I've seen plenty of unique objects that have been lodged up in the rectum. Typically, it's just your standard light bulbs, Scotch glasses, but nope, actually not one of these cars.
Wouldn't hurt to lose some weight. And he won't be able to walk until his hip heals. He'll need someone to take care of him.
I'll take care of him. Like you took care of me when I was sick.
The reason why we say weight, because you have more weight on the joint itself, and it's just putting more stress and strain on that joint. You know, the bodies are not made to have excess weight on it, and that's why you get concerned with somebody's weight, not just from diabetes, metabolic syndromes, cardiovascular disease, high blood pressure, but even just your joints, arthritis. You know, the more weight, the more it's going to hurt when you actually have inflammation of the joint itself.
Come back in a week. We can check your... What is that? That's the sound a blood pressure machine makes. I do impressions for the Doctor Talent Show. Do you know what this is? Rap. Rap. An MRI? Yes! Adding that to my set.
I mean, I've actually had an MRI done on my ankle when I was playing soccer back in the day, football for every international person out there. But it doesn't go rap, rap. It goes like clank, 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 clank. Changes up the frequency. Literally, you're in there just like listening to the banging noise as you're trying to listen to music and relax.
So, Doctor, is Peter healthy?
My goodness, you'll be dead within a month.
Dr. Hartman is using his stethoscope to listen to just the abdominal noises and sounds. What you're listening for is basically to hear if there's any movement or not movement. You know, listening to somebody's abdomen and then saying they have a month to live. Yeah, I wouldn't listen to that, doctor.
Mr. Griffin, you're going to expire in a month. This is your driver's license, isn't it?
Oh my gosh. You can have labs that show that you have renal failure, that if it's not fixed, you can die soon because of the abnormalities of electrolytes that might then cause you to have cardiac arrest. Unlikely that a blood test is going to tell you that your existence is not going to continue after a month.
Now, Mr. Griffin, that liver's got to come out.
What?
It's been in the microwave for 3 minutes. It'll get dry. Now.
Please.
Just focus, Dr.
Please.
Hartman.
We can't take any more shtick. Please just tell us, is Peter healthy?
Oh, yeah, he's fine. He's just really fat.
Oh, thank God.
Wait, hang on a second.
Yep.
Did you just say I was fat?
Well, yeah, you are pretty fat.
Okay, this is news to me.
Excess body weight can lead to metabolic syndrome, which then can lead to diabetes, hypertension, cardiovascular disease, a whole plethora of problems.
Hey, any of you know how to tie a tie? I have to go to a patient's funeral.
Luckily, as an ER doctor, we don't use ties. Somebody could use it against us. And that's also why even police officers, when they have a tie on, it's actually a clip-on. That way it breaks off right away.
Peter needs to lose weight, and we were hoping you could help us.
Sure, there are a few options we could try. You can increase your exercise.
Pass.
Switch to a vegan diet.
I'd rather die.
Or quit drinking.
Exercise is really good for you.
It's good for you!
Good for your heart, good for your muscles, good for long-term health. But typically you can't exercise out of a bad diet. With the majority of us, if you want to lose weight, you have to reduce the amount of calories that you're getting in your body. And then obviously alcohol, there's actually no true health benefit to alcohol. That's why if you do stop drinking, you actually lose weight pretty quickly.
What did Honey Boo Boo's mom do? We have a similar workout.
I'm a beauty queen.
She had lap band surgery. If you're interested in that option, the hospital is running a promotion where it comes with a free Nintendo Switch.
Oh my gosh. They put a band around your stomach to make your stomach smaller so that way you can't ingest as much food. Most doctors require that you actually show that you're starting to reduce your own weight by the normal steps of, reducing calories, exercise, watching what you eat. You don't want to have the surgery and then not have any lifestyle changes. Whoa, hey. You don't lose weight that fast, and you don't want to lose weight that fast because then you have a lot of excess skin.
Okay, so if I got like more skin,
it hasn't had the time to tighten back up, and then you're gonna potentially have to have surgery again to have a skin reduction.
I feel amazing, like a bride on his wedding day.
The skin is still innervated, meaning it still has sensation. So you're gonna be dragging that around on the ground. You're actually gonna feel it. It's gonna feel weird, awkward, and maybe even painful.
I can taste the floor. It's about my dad. He wants to have a sex change operation.
Typically, if somebody's having this type of surgery, probably do hormone therapies. Some rules require that you live for a year as the gender that you identify as. You just don't want to get into a situation where you're having major surgeries, you're removing organs, and then all of a sudden you want them reversed, and you get into a situation where you actually can't reverse those processes.
He has an appointment Friday with Dr. Hartman to have the procedure, and he wants me to go with him.
I thought he was like a family doctor. Typically, surgeon's a surgeon, and there's subspecialties within surgery. Then you have like family medicine doctors, internal medicine doctors that do general medicine practice. Then you have myself, emergency medicine doctor, who does emergencies.
Here's the deal. Anything he lops off, we get to bring home for Brian.
What? I've not been privy to any of these type of surgeries. It is definitely not like a restaurant where you get the leftovers and the bones to go, and so you can give it to the animals at home.
Wow.
You wouldn't literally go out to see family with blood all over you, wash yourself, change your clothes. Like, no, they don't want to see that.
That thing was on there.
That thing was on there. Yeah, duh. It's part of the anatomy of a human being. And penectomy is actually the word for penile removal. The biggest things you worry about are the blood vessels and the nerves.
How is he, Doc? Is he all right?
No, I'm afraid not. But she's gonna be just fine.
There you go. I mean, that was the fastest surgical recovery ever. Typically, no, you'll end up going to the PACU. The after surgery care unit will have the anesthesia wear off, make sure there's no excess bleeding.
What do you think, boys?
I'm walking on sunshine. Whoa!
It's great that Quagmire is supporting somebody who's having this choice. You want family support. I think that was a good depiction, even just in this scenario, even though Peter's kind of making a little bit of a joke about it.
Hey, how foon would it be if we waved sticks around?
I really don't know what we're doing.
It's foon from the word before. I don't see what.
Oh my
All right,
gosh.
first, let's take your blood pressure, because that's like our favorite thing to do around here.
Oh man. If somebody came to the emergency department with a foreign body stick in somebody's eye, you want to stabilize that bad boy. That way it's not just like willy-nilly flopping around. You're gonna eventually get the vital signs because you need to know heart rate, blood pressure. You need to know what you're dealing with, you know, respiratory rate, temperature, that sort of thing. Obviously there's going to be a globe rupture, a rupture of the eye itself, because there's a puncture wound to it, and it is dirty, it is foreign, so there's definitely going to need some antibiotics. Now the question ends up being, where was it injured, and then is the retina injured? You need an ophthalmologist.
Lois, you in the bathroom?
The biggest thing I can think about in this situation is not, you know, two adults, but when sometimes you have a newborn and you put the baby in the bed. From my experience as a physician, it's probably not the smartest thing to do. Maybe consider using a bassinet in the bed or next to your bed.
Well, Mrs. Griffin, you have 3 crushed ribs, but I was able to stop the internal bleeding.
The rib could cause bleeding for multiple reasons. You can have some bleeding from the rib itself. You can have bleeding from the blood vessels that run underneath every rib that we have, or the rib could actually puncture the lung. It could puncture the spleen or the liver. Rib fractures are horrible. They're very painful. You can't really brace them because you can't stop somebody from breathing, because it'll decrease the amount of air that's moving, which increases your risk of getting pneumonia and an infection.
No, we don't. He practically smothers me every night.
Well, are you hogging the blankets?
No.
I mean, I appreciate the, like, hey, try to figure out why he might be smothering her at night. I would think of 2 things. Either don't sleep in the same bed for a short period of time, or have like a barrier up when you go to sleep.
And if he's not smothering me, he's keeping me up all night writing with that giant plume of his.
Dearest Augustine, I do hope this latest damp has not aggravated your gray lung.
Why would a feather pen or a plume keep somebody up at night? I do not know, but him being up at night with a light on, having lights on definitely messes with your ability to go to sleep. That's why they say, you know, don't, you know, sleep with the TV on. Don't use your devices before you go to sleep. It has to do with the input that you're giving into your brain, saying, oh, it's light out. Let me stay more awake and be more focused.
Aggravated your gray lung. Dip, 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 dip.
Dr. Hartman called about my x-rays. He said my spine is now disfigured.
Ah, okay, so typically a spine that becomes disfigured is potentially from muscle spasms, obviously fractures, but a fracture causing the spine to be so disfigured would also have significant other implications, compressing nerves, not having other functions of your body parts.
You're a good swimmer. Go get it.
What? But Dad!
And for God's sake, do not be afraid to make me a sandwich while you're in there.
Oh my gosh, get out of the house. Risk of electrocution with all the appliances. It's just a dangerous situation. Get out of there. You don't know what might be lurking in the water. Different infections could occur in situations where there's stagnant water.
She's in there right now, taking a nap underwater.
For God's sake, save her!
My God, we better get her to a hospital.
Oh my gosh. Okay, possibly a near drowning. So drowning versus near drowning. Near drowning means that you almost succumb to your injuries due to water. Drowning means that you have died. Good, protect the head, but if she's not breathing, you need to be doing CPR. Mouth to mouth. There are instances where you do hands only CPR, but in this instance, you're trying to clear the airway of the water and get it out of there.
Mr. and Mrs. Griffin, I'm afraid your coma's in a daughter. I mean, your daughter's in a coma.
Oh my gosh, sometimes as doctors, we just say the wrong things at the wrong time. If you go to the emergency department and you're not breathing due to water, you're gonna have CPR. And now you worry about secondary effects of all the fluid that were in the lung. It can cause a significant amount of edema, swelling, also can cause reshifting of fluids and electrolytes.
Well, I am gonna change. You hear me, Meg? If you come out of this, I am going to treat you like a princess for the rest of your life.
So very interesting. Peter talking to Meg bedside. I literally tell patients to do that. They'll ask, you know, can the patient hear me? Do they know? I don't know 100% of the time. A lot of times individuals who have been sedated will tell us that they do remember certain events. Oh, waking up. Nice.
Well, hello, sleepyhead.
A lot of times patients, family members want to stay in the hospital, sleep in the hospital. There are kind of rules about that, unless it's a situation potentially where it's like life and death. And the reason for this is the staff is there to take care of a patient. And if there's a lot of extra people, it reduces the care that they end up getting.
This place is paying Meg to do what?
Nothing. When you have 1 million followers, people just pay you to hang out.
No, that doesn't happen. I have 1 million+ YouTube subscribers on the channel at the moment, and no, I do not get paid to randomly hang out. Shout out to you guys for subscribing to this channel.
Yo, yo, yo! Everything here is made with corn syrup. Just drink the corn syrup!
Please do not just drink corn syrup. High fructose corn syrup, basically what we add into a lot of things, especially here in the United States, to make things sweet for the sugar purposes. Oh my gosh. So Meg collapsed because of blood sugar being super high. Blood sugar can normally range in a normal person with a normal functioning pancreas and insulin production between 70 and 100, 110. Once things start getting higher than that, then they're concerned for diabetes.
Meg has type 2 diabetes.
Type 2 diabetes is basically you're not born with diabetes and you've put your body into such a situation where you've taxed it so much over time. Having high amounts of sugar in your body has significantly impaired your ability to manage the elevated blood sugars.
I need to draw a little more blood for the lab.
Oh my gosh. We don't actually typically put spouts into people. Obviously, we put IVs in. There are some type of devices that we'll put into people where if there's fluid in the lung,
he's got fluid.
Put a chest tube in that has a valve on it. If you have too much fluid in your brain, you can actually put a shunt in where you drain fluid out and you can adjust the valve as well.
As I suspected, sap.
Typically, people will put these type of devices into a type of tree to get syrup out of them.
I want to be picked up now, Mom. Fine, I'll see you at 4. What do you want?
Oh my gosh.
I have no idea what's going on.
Allergic reaction.
I feel like I'm turning back into my old teenage self, and there's nothing I can do about it.
Lois is stressing out, a lot of anxiety, and she has a rash. So this rash could be brought on by stress and get hives. Typically, if you treat the offending problem, control the anxiety, this will go away.
I see. Did you recently run into an old bully, or were you tagged in a very unflattering Throwback Thursday photo?
Wow. In the emergency department, if somebody comes in with an allergic type reaction, we give steroids, Benadryl, Pepsid, fluids, plus or minus an EpiPen. Just depends on the extent, and we're actually just trying to get the body to stop having an overreaction.
I did. I ran into a girl who terrorized me in junior high, and she used to call me Scully Lois.
Like scoliosis. That's very good.
Oh my gosh. So she's in a type of brace that's keeping her upright, all the way down from the lower back all the way to the neck. Look at that neck! This could be a type of scoliosis brace. You can also use this type of brace for different types of spine or vertebral fractures to keep in alignment.
Dr. Hartman, what's happening to me?
Well, Mrs. Griffin, I think you're suffering from severe nerd damage.
Severe nerd damage.
I'm a nerd.
I guess I have that too. But no, maybe nerve damage or autoimmune type reaction due to stress.
You see, all nerds are one tossed-off joke away from reverting to their worst, most humiliating selves.
But I don't want to be a nerd forever.
Tell you what, find the coolest guy in school and give him a tug behind the bleachers. That usually solves it.
Oh my gosh, no. She also has an eye twitch on the left eye, and that could also be related to muscle spasming, stress. Just like you'd have a cramp in a leg, you can have cramp in the eyelids. There's multiple different muscles that affect that eye as well as nerves.
Does that really work?
I don't know. Why don't we go find out?
Oh my gosh, Dr. Hartman totally inappropriately hitting on his patient.
Inappropriate.
There is no right scenario where a doctor should be dating a patient.
I think you can do that and a whole lot more.
Oh my God, that is not what a testicle is supposed to look like.
Individuals that have testicles should be doing at least weekly exams on themselves to check the testicle and make sure that there's no abnormal growths, lumps, pain, anything weird.
Mr. Griffin, I'm afraid you have testicular cancer.
Oh no, okay. The earlier that you catch any type of cancer, the better the outcome is going to be. If you wait and delay, things can spread throughout your whole body and then you are a ticking time bomb.
We're a time bomb.
I'm sorry, there's nothing I can do.
Oh, I think maybe there is.
If you keep doing that, you're gonna pop it.
Typically, if you're going to pop something in our body, it's usually something that's fluid-filled. Testicular tumors and cancers can be fluid-filled, but typically it's an abnormal growth of tissue.
God bless you.
Then, unfortunately, it starts to metastasize to other parts of our bodies.
Stand back, Brian. I'm preparing for my vault.
You can't vault inside the living room. You're gonna get hurt.
Yeah, I'll get hurt right onto a Wheaties box.
Wheaties is the type of cereal that's not the best tasting. It's notoriously known for putting athletes on the box. Oh! Anybody out there ever have a gymnastics situation gone wrong, either home or at the gym? Let me know in the comments.
I think I'm okay.
Whoa!
Uh-oh!
Hopefully this piece of glass only went so far as touching the soft tissue and not anything deeper. We'll do some imaging anyway because sometimes glass will be embedded in different areas and you can't see it.
Uh-oh! Uh-oh! Oh God! Somebody!
With lacerations and injuries to the face like this, we typically use sutures because we want to use the smallest possible material we can use. And typically you're only leaving stitches into somebody's face maybe 5 to 7 days at most.
Do I take it out or do I leave it in? Do I take it out or do I leave it in? Ah!
What would Dr. Wagner say? Don't pull it out, stabilize it, get to the hospital ASAP. There are some major blood vessels in the forehead that bleed like stink, so that's why you don't want to remove it right away because you might bleed a ton before even getting to the hospital.
What the hell?
Uh-oh, Peter, maybe you better take a break from yelling for a bit.
No, it's fine. Don't throw it to Griffin. She said...
The loss of voice, laryngitis, inflammation of the larynx, non-specific inflammation, which then doesn't allow your vocal cords to reverberate and vibrate as they normally would to get phonation out, to get the sound out.
Are you gonna help us? He's barely been able to speak.
He needs to rest his voice. He absolutely must not talk for at least a week. If he tries to speak too soon, he could damage his vocal cords and lose his voice forever.
Oh my God.
So you want to relax. Just relax. Your vocal cords because there's inflammation, so you don't want to use them. It's like anything where you strain a muscle in your body, you don't just keep using it, you need to have time for it to recover. Oh, he's writing.
What is it? Is he trying to say something?
No, he just wanted to show me he threw a Garfield.
Singers get this a lot where you can actually get some like growths on the vocal cords.
I am living with notes.
There's a lot of different things that could occur, but most commonly it's just inflammation. Could be just from overuse. Definitely get checked out, have somebody take a look at it, especially if it's going on longer than a few days.
I'm gonna be a surrogate.
But don't you need an egg?
Jeffrey and Bruce already picked out an egg donor from a website.
Surrogacy, it's a legal arrangement. The pregnancy will grow inside the uterus of this other individual. And then once the baby's delivered, it's given to the couple or the family that had this process started.
You can just get hot eggs off the internet? What website?
There are different ways you can go about fertilizing an egg. I'm assuming there's a donor egg and a donor sperm that might be fertilized elsewhere and then just implanted versus surrogate eggs.
Meg, this is serious. Pregnancy is not something you do for money or to keep a certain professional athlete interested after he blocks your number.
Oh, man. As an emergency medicine doctor, don't go down this road. But if somebody were to come to the emergency department that has any complications relating to pregnancy, typically they come to the emergency department for bleeding or pain, and we're doing ultrasounds, blood work.
Dang, no more sush for Meg for 9 whole months.
That's honestly what you're taking away from all this?
Well, yeah, I'm still getting sush. Anyone else for sush? Dad sush?
Stewie is talking about sushi. Because sushi is raw fish, it increases the risk of microorganisms like bacteria and parasites. There's a lot of foods out there that they do suggest to try to avoid to reduce any risk.
It's on the bad food list you gave me.
Oh, this is embarrassing. We wore the same thing. Let it be noted that I was the one to change this time.
I highly recommend not going into the hospital barefoot. Yes, they do a good job of cleaning it and sanitizing it, but it's a high concentration of germs. So you need to just make sure that you're not increasing that or taking it with you, so to speak.
The fertilization of the hella more attractive egg was a success.
Brucey, we did it!
Yeah, so now we just have to implant that very hot embryo into Meg's body.
Is this gonna hurt?
Not at all. Nurse, wheel in the implantation cannon.
What? Dr. Hartman behaving as an OBGYN. Now, he's a family medicine doctor, I believe. They can do these types of potential procedures if they're trained that way, but I would recommend going to an OBGYN that specializes in fertility medicine.
You guys are going to love this thing. A clown died in there, but I think we got them all out.
I have delivered many babies. When I'm delivering a baby, it's due to the fact that it's an emergency and the baby's trying to come out and see the world ASAP.
See world? All right, let's see what we have here. Oh, the baby's crowning.
If the baby is being delivered, typically you're actually in a sterile gown and sterile gloves. And when they describe that the baby is crowning, that means you're starting to see the head of the baby come out.
Well, these don't feel like gloves at all.
There's a
They feel like
biohazard.
used needles.
Yep. Oh
Well,
my
this is
gosh,
where
she's
I
gonna
always
come
keep
out
the
with a
gloves.
handful of needles. You don't have the biohazard needle bin there. It's got specific devices to prevent your hand from going in, from needles and anything sharp coming back out.
Oh, maybe if I dig deeper.
Ah.
This feels like more needles. Well, that's the craziest thing. Oh, now I'm sure this isn't the glove drawer.
Oh my gosh. There's no way to know what type of exposure this is. You need to go down the route of, do you put somebody on medications to prevent any transmission of viral illnesses? Potentially, yes.
Oh my God, who's gonna deliver my baby? Honey, do something.
Then leave Dr. Hartman on the ground, most likely passed out. Most of the time, delivering babies is quite simple.
It's easy, you just catch.
Sometimes there are complications, very anxiety provoking, a lot of adrenaline going around, but they just make their way out.
No baby, but it looks like Carol's blowing a bubble.
Peter, that's the head.
Some babies come out bald, some babies come out with a full head of hair, so it just depends.
Oh my God.
What? What?
It's a beautiful baby girl.
Oh, a baby girl. I'm so happy.
But she has a penis. Well, we'll have to do something about that.
Peter, no, it's a boy.
Oh, the baby doesn't come out so clean. It's got a lot of white material all over. You gotta clean out the airway. You gotta warm the baby because the baby now just came out into the cold air and it's gonna be freezing. And then you give the baby back to the mother.
Holy crap, a vintage Mr. Potato Head from the good old days when potatoes were men and had penises.
What does that even mean?
That's the very potato I used in medical school to learn anatomy. I could let it go for 600.
In medical school, when you're actually studying human anatomy, you're doing a cadaveric lab, so you're doing dissections. In the med school that I went to, we actually had 4 individuals to a single cadaver.
We don't have that kind of money.
Fine, I'll buy it with my magic beans.
Those are Skittles.
Pretty intense anatomy in medical school, not where you would use Mr. Potato Head.
I wish I had a jetpack. My life would be better.
Oh geez, dangerous.
Oh, 360.
360 pounds, not good. Carrying that much weight increases cardiovascular risk of death, so please be aware of that. Eating healthy, losing weight are things that we can do, as well as exercise.
Oh, wait, 180.
Every time you go to a doctor's office, even the ER too, we need a height and a weight. And the reason for this is it's helpful for us with medications because there's a lot of weight-based medications. A lot of them are milligram per kilogram.
Very good. Now let's get your height. All right, so you're 7'6", 180 with colorectal cancer.
I'm tall?
Oh my gosh. Colorectal cancer, colon, rectum. These are cancers that we can screen for doing a colonoscopy, which is highly recommended, especially here in the United States. Make sure that you get them. They've actually lowered the age to 45 to start screening. If you can catch it early, it is quite treatable.
I'm tangled. I'm tangled in your wallet chains. Stop!
Oh my gosh, who remembers wallet chains? I don't know if they're a thing anymore. I think my older brother still uses one.
I can't feel my arms. One of you tattooed Betty Boop ladies, help me!
Oh my gosh! Come on!
Come on!
Do we get instances where people come to the emergency department where they get simple things wrapped around a part of their body part which causes an issue? Yes. Something that's quite common is something called a hair tourniquet. It happens in little kids where the hair actually wraps around like your finger or toe. Sometimes we'll actually use Nair, which helps remove hair, so it actually breaks down the hair itself.
Hi, I'm the lead singer of the Cherry Poppin' Daddies. My name doesn't matter. Please, don't wear wallet chains to our shows. Otherwise, you could end up with both arms ripped off like this guy.
Wow. In this circumstance, could you actually rip somebody's arms out? Potentially, especially at like joints. If the joint is able to be dislocated, that joint can be ruptured in the sense that like the ligamentous attachment will be pulled apart.
Peter?
Uh-oh.
Oh, Peter, thank God you're awake.
Well, what happened? This should explain everything.
Farewell to arms. Oh my gosh. Can you put those arms back on? If you have the arms and it's a very clean cut and you have the anatomy there to be able to do it, there's a potential.
We couldn't reattach your arms. Oh my God! Don't worry, they'll grow back. Just spread the seeds on, keep them watered, and watch them grow.
Come on. Come on! Wait a minute, why are they removed at the shoulders, first off? Because that's not where the injury was. They were pretty much like mid-arm. All I can think about is Ryan Reynolds and Deadpool. This is the same thing.
Peter.
Chia.
Oh my
See,
gosh.
they're already coming in.
There are individuals out there that do have their hands proximally attached like that due to multiple different reasons, and they actually have the ability to function normally, and they actually are thriving.
You see, Kev, nothing's gonna stop you in the real world except for your own cardiovascular system.
Hey, I'm only heavy because Adam Sandler made me gain 60 pounds to be in his movies.
So that's supposed to be Kevin James. Yes, so if you are overweight, it increases risk of cardiovascular disease. So sometimes you could say, oh, I'm healthy now, my blood work looks perfect, but it just increases demand on your system.
Demand suddenly skyrocketed.
Oh.
Ah, what happened to your hand?
I don't know.
Let me guess. One of you chuckleheads has a nutcracker inside you.
What? No.
Hi, we're non-judgmental interns, just here to observe.
False alarm, not what I thought.
Oh my God. Not cool at all. If you go to a teaching hospital, an attending physician might have on their team residents, interns, medical students, even pre-med students observing. And there are times when patients will say, oh, I don't want that. Oh.
Kevin, your arm. It's getting worse.
I think I see what's going on here. Kevin is fading away because streaming has made him irrelevant. Sitcom stars like Kevin clearly need the laughs of a studio audience, or he may disappear forever.
His hair was disappearing too, but I assume he took care of that another way.
Typically, hair loss, it happens as we get older, and that's normal, but sometimes people have early hair loss or male pattern baldness or alopecia. There are different things that you can do. Hair transplants, you can use different topical medications, you can use oral medications.
Peter, I'd like to introduce the surgeon who will perform your procedure today. Dr. Wagner.
Dr. Wagner. They're alluding to potentially the surgery that Peter is having. They're doing procedures nowadays that could adjust the physical anatomy. That is not my expertise or specialty.
Where do you think you're going? Doc, I'm not actually going through with the operation. I'm going home.
We're doing this whether you like it or not.
Doctors cannot assault individuals. We get into situations where family members really don't want us to let somebody go home, but if somebody is of sound mind and can understand the consequences of their actions and is not endangering anybody, we cannot hold people against their will.
Doc, no! Stop him!
And so he's got a scalpel that almost looks like a 10 or 15 blade, probably a 10 blade. The 11 blade is what we use more often in the emergency department. We would use that to maybe cut open an abscess or help put in central lines that we need.
Sir, I think you should know these growths on your forearms. They're giant tumors.
Oh my gosh, it's Popeye. But it's funny that he's always known for these big, huge forearms. Tumors don't present this way. The tumors would be probably asymmetrical and they wouldn't be bilateral like that.
And the speech thing and what you're doing with your eye? You had a stroke about 7 years ago.
Typically, a stroke would spare the ability to lift your eyebrow. So if somebody comes in and they can't lift their eyebrow on the same side where they having a facial droop, the likelihood is that they are having Bell's palsy.
That you've managed to be walking around all this time is nothing short of a miracle. I'd say about 2 months.
If somebody in your life has stroke-like symptoms, get them to the hospital ASAP. Within a 3-hour window of the onset of symptoms, or 4.5 depending on certain criteria, we can give a medication systemically in an IV that will break up a clot that might be causing this.
Oh, Peter.
Oh, Lois, I missed you. You and your wonderful smile and your beautiful eyes and your awesome third boob that's on top of the other boob.
What?
What?
Oh, my God. Peter, that's not a boob. That's a lump.
It's really important to do breast exams, feel your tissue, and make sure that you're not feeling any abnormalities. You should be doing this in the shower. You're palpating and then going out in a circular fashion to hit the whole breast so you don't miss any area.
Mrs. Griffin, I've got good news. Your test results came back negative.
People will come to the emergency department immediately to get evaluated. You can do an ultrasound to make sure that there's no sign of like an abscess, but you need a mammogram, and then after the mammogram, if there's a lump in that area, then you're going to potentially need a fine needle biopsy or potentially a little bit larger biopsy.
It appears the lump in your breast is not black gross boob death.
Breast cancer?
That's the layman's term, yes.
Oh, thank God.
Black gross boob death is not a current medical term that we use. We'll say cancer, tumors, mass in a cancer diagnosis rule out situation. You just want to be straightforward. You don't want to try to be funny.
What a relief.
Yeah, that was scary.
If you find yourself in a situation like this where you're facing the occasional stresses, I want you to check out my formulated supplement called Chillax to help calm the body and the mind to bring those chill vibes.
Now, Mrs. Griffin, although you're in the clear for the moment, we need to have a look at your family medical history to determine your future risk.
Family histories are very important. We ask about family histories because we want to know, is there increased risk? Are there anybody else in the family that died of different types of cancers or that specific type of cancer that you're worried about? Oh! I didn't count how many bullets went through the thorax, but a lot. Now, I've been in situations where somebody has gotten a lot of bullets into the chest and they actually survive versus one. It actually does depend on where it actually hits and what major vessels and organs it's missing. Oh my gosh, still breathing, still alive? If somebody were to have penetrating trauma and then lose pulses, you end up doing a thoracotomy where you basically crack open the chest and see if you can get to the heart and see if there's any damage to the heart itself, such as like a hole through the heart, and then you repair it immediately. A bullet to the brain, again, if it goes straight through, missing certain structures of the brain, you could potentially still be alive. It, again, depends on the area.
Oh my God. Where am I? What happened?
Oof, coma breath.
Coma?
People do wake up randomly from being in a coma, so his airway was protected, didn't need a breathing tube or oxygen, but he was not waking up and then randomly woke up. This does occasionally happen.
Can I go home?
Well, you're not really ready, but if it's for revenge, you can stab me with this scalpel and then run out.
There are different types of scalpels out there. We use different types of blades on the top of these scalpels. And the most common instruments that we use in the emergency department is an 11 blade, a 15 blade, or a 10 blade. The 11 blade is the most common in the emergency department because it's pointy and straight.
Thanks.
What?
Oh, that was unnecessary, but cool.
Peter jumps out of the bed after being in a coma. The likelihood of being able to do that is pretty low because you're going to have atrophy of your muscles, your strength is going to be very low, and your ability to just jump and run is going to be significantly decreased, and he probably would fall and hurt himself on the floor.
So awesome.
What?
What?
That amount of trauma to your eye, call the ophthalmologist, try to prevent any touching of the eye because it increases all the fluid coming out. You'd actually want to put like a cup or a shield over your eye if there's actually eye trauma and get to the hospital ASAP. Oh! Oh my gosh. That's so dangerous. And we actually see this type of injury come to the emergency department often enough. Sometimes fans, sometimes propellers. In the face, if you get lacerated, a lot of times they bleed like stink, but they actually have pretty good repair as long as there's chunks of tissue not missing.
What happened?
Ah, I knew you'd catch it. I'm parting my hair on the other side now.
Oh my gosh.
Peter, thank God you're okay.
Hello, bosses, and not my family.
It's good. Peter wakes up and he's able to recognize these individuals, so that's a good sign of good brain function. Sometimes people who get hit in the head, they get something called transient global amnesia, where they can't remember events or they continue to repeat asking questions.
Where am I?
It does take time for that to go away.
You really gave us a scare there.
Oh, what do you mean?
What? You went into a coma after you were hit in the head by a fan. Oh, it was funny.
We induce comas all the time when somebody is super sick and we need to sedate them and put them on a ventilator. If you're just not waking up due to head trauma, typically you don't see that very often. You see somebody gets knocked out and then they slowly wake up.
Since the company was paying for your medical care anyway, we fulfilled your letter of medical intent for your sex reassignment surgery.
What?
They fulfilled what the letter of intent of what Peter wanted, but you need to consent for all those procedures and go through everything, so they wouldn't do that. Wow. So could that happen? Would that happen? No. People are like, well, I'm going under to have X procedure. Why don't you just do all the other procedures while I'm under? Somebody then is under anesthesia for a lot longer period of time. Your body is then required to also recover from so many different ailments that it actually might overburden the system.
I wish everyone was Robin Williams.
Oh, geez. When you get electrocuted by lightning, that is direct current. You wouldn't see somebody doing that weird twitching thing. That is a contraction, relaxation, traction, what you would see with alternating current.
Boy, that looks enticing.
What?
Yeah, this is nice.
The biggest issues besides muscle breakdown, rhabdomyolysis, kidney failure, electrolyte abnormalities, cardiac arrhythmias leading to ventricular tachycardia or ventricular fibrillation leading to cardiac arrest and death. So these are things that you really worry about.
Oh my God, what happened?
You were in a coma, and then I kissed you and you woke up.
Stop it. Again, coma again. Family Guy likes to use coma a lot.
He's in what we call a coma. Anyway, all your numbers are normal.
What numbers?
No idea. Well, congratulations. You're gonna be just fine.
Oh
my God, you're Robin Williams.
Peter's wearing bandages to his head and to his face, so yes, you can have open wounds due to electrical injuries, burns to the skin. They all need to be managed appropriately. So you can have 1st degree, 2nd degree, 3rd degree burns, 4th degree burns.
What's going on in here?
You gotta check this out. It's Robin Williams.
Oh my gosh.
Nurse is a nurse of course.
So, does somebody continue to be electrically charged after getting electrocuted? No. But you do know that we develop like static electricity, and that's just because of our own charges. A lot of things in our body are related to action potentials and electrical energy.